Well, I think that at some point people are more concerned about their daily life and how they feel and not the length of life. I mean, I think that for most of us, if we have a disease, we want to be able to cure it, we want to be able to live as long as we possibly can. But I think people sometimes get to a tipping point, and where the daily life and how they feel each day is more important than how long they live.
Often these days, people I meet are seriously, seriously ill. They are sicker as they die these days than they used to be.
The beauty of sort of taking a palliative care approach is to say to a particular individual, what makes your particular day a good day? What is quality of life for you? Help me understand what that is, as opposed to just assuming that everybody feels about their symptoms the same way.
I am a palliative care physician, and I would like to talk to you today about healthcare. I'd like to talk to you about the health and care of the most vulnerable population in our country, those people dealing with the most complex, serious health issues. Cancer, heart disease, lung disease, renal disease, dementia. I'd also like to talk to you about palliative medicine, a paradigm of care for this population, grounded in what they value, patient-centric care based on their values that helps this population live better and longer. It's a care model that tells the truth and engages one-on-one and meets people where they're at. Well, the Dartmouth Atlas, about 6 years ago, looked at every dollar spent by Medicare, generally this population. We found that those patients who have the highest per capita expenditures have the highest suffering, pain, depression, and more often than not, they die sooner. More is not more. Those individuals who had more tests, more bells, more whistles, more chemotherapy, more surgery, more whatever, the more that we do to someone, it decreases the quality of their life. And it shortens it most often. Yes. We focus on disease and pathology and surgery and pharmacology. We miss the human being. How can we treat this without understanding this? We do things to this. We need to do things for this. All the evidence that is related to palliative care these days demonstrates with absolute certainty people live better and they live longer. A seminal article out of the New England Journal of Medicine in 2010, study done at Harvard, friends of mine, colleagues, end-stage lung cancer, one group with palliative care, a similar group without. The group with palliative care reported less pain, less depression. They needed fewer hospitalizations. And ladies and gentlemen, they lived 3 to 6 months longer. If palliative care were a cancer drug, every cancer doctor on the planet would write a prescription for it. Why don't they? Palliative medicine is the answer to engage with human beings to change the journey that we will all face and change it for the better. I ask that we stand and we shout and we demand the best care possible so that we can live better today and ensure a better life tomorrow. We need to shift today so that we can live tomorrow.
Palliative care it's positive if you let it be. I mean, it doesn't have to be giving up. Now you're fighting for a different side. You're fighting for your health. You're fighting for the healthy part of you.